My name is Asif Parkar. I'm an orthopedic consultant based in London. I trained through the prestigious Royal London Training Program, which is part of the London Deanery. I completed my certificate of training, which is called CCT, Certificate of Completion of Training, in 2017. Following this, I have done national, international fellowships, including 1 year in North America, where I honed down my practice to hip and knee specialist, which is my area of expertise. Within hip and knee, I specialize in sports knee injuries and also joint replacement surgery. I also have a diploma in robotic and computer-assisted orthopedic surgery because I'm a firm believer in incorporating innovation and technology in modern day medicine. I do perform robotic surgery on regular basis, where I do joint replacements using robotic technology and also some complex deformity correction. And we have had great success with this. And I think this is the way forward in orthopedics. And I'm very passionate about it, and I thoroughly enjoy this technology. I was appointed a substantive consultant in BHRUT, which is in East London, based at Queen's Hospital and King George Hospital. And outside my national health practice, I also do private consultations and operations in private hospitals from East London to Central London. I specialize in hip and knee surgery, and within that, half of my practice is joint replacement and half is joint preservation surgery. And other than this, sports knee injuries. On an average, I perform about 400 to 450 operations every year. And the National Joint Registry, which keeps the data for all the surgeons in this UK, as per that data, I perform approximately 200 to 250 joint replacements each year. And the remaining surgeries include ligament surgery, arthroscopy, joint preservation surgery, or trauma surgery when I'm on call in my NHS hospital, where I perform surgery for the fractures and injuries. I also have super specialization in some areas, which is osteotomy, which is basically a surgery performed where you shift the weight from the arthritic part of the knee to the non-arthritic part of the knee. And that is typically performed in middle-aged men and women who are very fit, active, and for that reason, both patients and us, we prefer deferring the joint replacement to keep their high level of activity as much as possible. Another area where I specialize is patellofemoral instability, which is where the kneecap or the patella keeps dislocating. And then based on the severity of the problem, we offer them treatment from rehabilitation to surgeries, in which there's a different spectrum of surgeries. Other than this, I am actively involved in research. I have published several papers and book chapters, most recent being a couple of chapters in the orthopedic textbook called Evidence-Based Orthopedics. I've also written a chapter on osteotomy for ESCA. ESCA stands for the European Society of Sports, Trauma, Knee Surgery and Arthroscopy. And I've published some papers in some of the most esteemed journals in orthopedics, such as Journal of Arthroplasty, Journal of Bone and Joint Surgery. I've always had a trainee with me, and I work in a hospital which is affiliated to London Deanery, London University. I was awarded Trainer of the Year in Orthopedics through this in 2022, and I was also nominated in 2024. I'm also the infection control lead for my NHS hospital, where I hold regular meetings with my microbiology consultants, and we keep updating our hospital antibiotic protocols and proformas. I feel in trauma and orthopedics and the job I do, I am passionate about it, and we get the patients back to their previous level of activity. We try and make them pain-free and improve their quality of life. And the end result of the treatment that I get is what keeps me going. Is the patient feedback. Uh, Across different platforms, I have got over 500 plus 5-star patient reviews. Most of them are through I Want Great Care, which is a platform where consistently from 2022, successively for the 5 years, I've been awarded Certificate of Excellence for providing outstanding patient care. I do believe in holistic patient care. Uh, I treat each patient as an individual. I try and engage with them to find out exactly what is it that I can help this patient with. Sometimes it's just pain management. Sometimes it's just dedicated rehabilitation with physiotherapists. Sometimes it's a simple surgery. Sometimes it's a really complex surgery. And each patient has individual requirements to fit their lifestyle, their symptoms, and I try and cater that to an individual patient rather than one thing fits all. And I get a lot of positive feedback from them.